Hello, everyone. I'm so excited to be here today with a very special guest who I'll introduce in a moment. But first, I'll introduce myself. My name is Melissa Berry. I'm the founder of CancerFashionista.com. I help women look and feel their best throughout their breast cancer journey and beyond. And I'm thrilled to be partnering with the AIRS Foundation for their Airing It Out series, which we kicked off in October for Breast Cancer Awareness Month. But it's been so well received that we're going to continue it throughout the rest of the year and beyond. AIRS Foundation's mission is to be a resource and a support system for women who have had mastectomies as a result of breast cancer. And we educate them on reconstruction options and ultimately assist them with the cost of reconstructive surgery. So thank you to the AIRS Foundation for creating this platform for us today. And it's also, I just want to point out, whether it's Breast Cancer Awareness Month or not, it's never a bad time to help women that cannot afford breast reconstruction. So please consider making a donation to the airsfoundation.org anytime. So without further ado, I'm so excited to introduce my special guest, Terry Kuti. Thank you so much, Terry, for joining us today.
You're very welcome. Can you hear me okay? Because I was told my microphone is on mute.
I can hear you perfectly.
Okay, so that must mean we are recording. Good, excellent. Hey, Melissa, I just want to tell you, I'm kind of excited to meet you.
Oh,
Cancer
Fashionista. Blush.
Well, good. Then, in this November season, it's always good to blush. No, I love looking at your site, Cancer Fashionista.
Oh, you're so sweet. Thank you.
Because, as breast cancer survivors, we both are, we know that our body gets assaulted sometimes by treatment and by surgery. So when I go on your site, it's just uplifting to me. And I think that's fun what you're doing and putting a little fashion flair and fun. And also, you feature some of these wonderful women who have used their breast cancer experience for a better cause too. So
thank you so much. I didn't realize this interview is going to be, kicked off by such a wonderful testimonial, but thank you so much. And I have been admiring you from afar. You've been doing incredible work. And when I saw your name pop up on our guest list, I was just so thrilled, and I couldn't wait to meet you and actually learn all about what you do along with everyone else here. So thank you again for joining us and for your very kind words. You're so sweet. Thank you. Thank you.
Yeah, you didn't know you were going to get that free little jazzy plug in there today, did you?
But no, you're hired. You could be my agent.
Okay. I'm thrilled to be here today, and thanks to AIRS for hosting this and having me today. I'm very
absolutely. I agree with that one. Thank you, AIRS. So I am going to bear with me. I never like to get the bios wrong, so I'll be reading a little bit. Thank you again for joining us. You are a 2-time breast cancer survivor and the founder and director of DiepCFoundation, a nonprofit 501c3 organization providing education and resources to empower women and men, which I love, to make an informed decision about options for breast reconstruction after a mastectomy. You started this nonprofit organization in 2016, just 2 years after your own successful breast reconstruction, realizing how many women and men needed support through their own journey to explore breast reconstruction options after mastectomy. Resources provided by the foundation include educating patients about the process of breast reconstruction from planning, surgery, and throughout the entire healing process. We connect patients to highly skilled, board-certified plastic surgeons. Kudos to you for creating this incredible platform. And I mean, I'm just, again, so thrilled to be talking to you about this type of surgery, because I myself, actually, I had implant surgery, but I always like to learn about all the different options, because I have so many women on the daily that are asking me, what should I do? What are my options? So thank you again for joining us today. So before we go into the questions, I would love to hear about your own breast cancer experience and why you decided to go the route of the deep flap breast reconstruction.
Yeah. Well, I have had breast cancer twice, so I have been run over a time or two, as they say. And when I had my second diagnosis, Melissa, I walked into my breast surgeon's office the day that we were going to talk about my surgical treatment plan. And I was supposed to find out from her that day if, in fact, she was going to be doing a double mastectomy. Since it was my second occurrence, I had a recurrence in my left breast and a new primary in my right breast from a diagnosis in 2002. And in 2002, I had 2 lumpectomies, 18 weeks of very intense chemotherapy, and then that was followed by 6 weeks of radiation. So when I had this recurrence in 2014, in May of 2014, when I walked into her office that day, I was pretty sure that I was going to lose both of my breasts. And I was prepared for that. And she told me, she said, well, Terry, that's probably likely going to happen, but we're going to do some more scans. And so we chatted for quite a while. And she told me about what her plan was. And I knew when I talked to her that day, I thought, this is a woman who's listening to me as a patient. She's giving me all my options and for breast surgery. But then something happened that I wasn't prepared for. She talked about breast reconstruction. Wasn't even on my radar that day. I knew nothing about breast reconstruction. She gave me all of my options for breast reconstruction too. She told me about implants. She told me about using my own tissue. But for me, I think I decided that day before I even walked out that I was going to have DIEP flap because she called it the gold standard.
Okay.
And when she told me I could use my own tissue, it resonated with me. It just was part of who I am. I'm a bit of a purist. I didn't want anything foreign in my body, but that was my personal choice. I did go home and I looked at the implant information. And I searched through all of it and carefully thought about it. It's a huge personal decision for women.
Absolutely. And I always say, there's no right or wrong. It's personal. It's like, do you want to be vegetarian or not? Not that it's the same thing, but I'm using that as an analogy. It needs to make sense for your body, your lifestyle, and your philosophy.
It absolutely does. And so, I had a double mastectomy in May of 2014. And at the time, this all kind of evolved into what I'm doing now. But at the time, there wasn't a surgeon in the town that I was living in that I would have gone to because she gave me so much information. And also at the time, Melissa, I was actually in my master's program for teacher leadership. So I loved the research process. I was really just, interested in that.
There was plenty to look at online.
Yes. But what I realized is you really have to look at some important factors when you're looking for any plastic surgeon to do your breast reconstruction. So through that research, I started setting up my own criterion. So I had what is called delayed DIEP flap, and she did my double mastectomy. And what she did was a skin-sparing, nipple-sparing mastectomy. She was very clear to me at the time that because of the tumor location, she says, I really feel that I can save your nipple and areola complex, but there could be a blood source compromised, and they could necrose and die. She was very straightforward and very transparent with me about all of that, which I so feel patients need to know all of that going into any kind of breast surgery they're having.
What the risk factors are.
Yes. And so very successful nipple sparing, skin sparing mastectomy. In the 7 months that I was researching my reconstructive surgeon, I went to physical therapy, and she taught me, I didn't have expanders because I'd had radiation on my left side. And I think there was a concern about infection or, the skin being compromised with an expander. And so my physical therapist taught me how to massage and pull my skin away and keep it away from adhering to my chest wall in preparation for my DIEP flap. And then in December of 2014, I had my DIEP flap surgery.
Wow. Well, thank you for, explaining your journey and your thought process and your experience. For those that are maybe are recently diagnosed and are doing their own homework, so to speak, right now, how exactly would you describe what deep flap breast reconstruction is and means?
Mhm. Yeah. So my, the foundation that I set up, DiepCFoundation.org, the name at the beginning says deep, but we advocate for all choices of breast reconstruction, which is using your own tissue. And there's a number of different places you can use your own tissue, but we'll talk about deep flap today to answer your question, Melissa.
Sure.
There's implant surgery. There's a combination of those two. You can use both, but also there's the choice to have no reconstruction. And so our foundation has also connected with the flat closure group. And, I've talked to people about optimal flat closure because a lot of it has to do with plastic surgery and the correct questions to ask for the appearance of how you look after surgery. So for deep flap, what that entails is taking the tissue, your tummy tissue, and they cut an elliptical shape in your tummy area. So you have a hip bone to hip bone scar. But the elliptical shape is the tissue and underlying blood vessels. We have an amazing map of blood vessels in our tummy area. And they disconnect that tissue and the blood vessels without using the rectus abdominis muscle. So no muscle is taken, thereby you don't have that compromise of not being able to do a sit-up or any of that. And so they disconnect that tissue and then they reconnect it to the breast area using another vein or artery, and they connect those blood vessels, and then you have soft, warm tissue.
It's amazing to think about it. It's really amazing.
Oh,
Do you know how long doctors have been performing this type of reconstruction?
Yeah. So, microsurgery, to answer your question directly, Melissa, deep flap has been performed in the early 1990s in the United States.
So it's still relatively new.
Relatively new. I mean, doctors have been doing it successfully for, close to 20 some years now. And there is a gentleman who is called the pioneer of the deep flap. But really, using your own tissue to replace a body part that has been damaged by disease or an injury, it's been around. It's a fascinating study to me. It's been around since World War I. And they, soldiers that were damaged in the war, they were using this vascularized tissue, just like the deep flap, and they were repairing, wounds during the World War I. And so it's just a fascinating, microsurgery is a fascinating, piece of, it's a specialty of plastic surgery. And it's just fascinating for me to read about it and to try to understand it, to help other women try to understand it too. So yeah, early 1990s, we've been doing deeps here in the U.S.
Got it. Well, thank you for sharing your insight on that. And what would you say are some of the risks that might be associated with doing deep flap?
Well, you have to think you're transferring skin, tissue, and blood vessels. So there's always the risk in surgery of seroma, which is a fluid collection. When you disrupt tissue, there is that chance of seroma. They do put drains in, and you probably had them too for your surgery, Melissa. So you know about, yeah. Surgical drains are used to drain that fluid off, but even in the best of circumstances, sometimes women will develop a seroma.
Okay.
There also is a blood collection called a hematoma. It's not as common, but that can happen as well. And women can go into this surgery in the best of condition, their skin, their overall health, even in the best of condition, there can be wound healing issues. They are doing amazing things now. There are devices that are used to minimize that, but there are still women who deal with wound issues. I think what's important, though, is to choose the best plastic surgeon, the best microsurgeon you can find. I always say, even when there are hiccups, seromas, hematomas, wound healing, even when those happened, a good microsurgeon is going to see you through those and get you to the other side. It might take a little longer if there's some hiccups or those risks occur, but they're going to see you through to the other side and get all those issues resolved.
Absolutely. I hear what you're saying, because even with implant surgery, like, nothing is perfect. There are always going to be, like, my oncologist, when I started asking questions about breast reconstruction, he was like, Melissa, if you're going to take Advil, if you're going to read that bottle, you might not want to take Advil anymore. I mean, unfortunately, there's a risk with everything. You just have to know these are calculated risks, and like, to your point, you want to make sure that you are working with a microsurgeon, a plastic surgeon, or a surgeon that does the microsurgery that's obviously done this for some time and this is their specialty.
Yeah, because they're used to dealing with risks. They're used to dealing with the risk of surgery and what can be due to minimize them, but also to handle them if they do happen. So
got it. So here's a question that I know when I was going through my own decision making process, a lot of women ask, is it true that you can get a tummy tuck during this deep flap surgery? How would you answer that question?
That's a really good question, Melissa.
We always like to think, well, as long as I'm under anesthesia and as long as I'm with the plastic surgeon, let's do this. But it doesn't work that way.
Well, the term tummy tuck is a misconception, but let there be no mistake. Your tummy is tightened down and a lot flatter after you have deep flap. But here's the thing. Here's some of the differences. When you have a tummy tuck, an official aesthetic tummy tuck, they're not concerned about blood vessels. The skin is taken. It's not that different of a scar. You still have a hip bone to hip bone scar, but the surgeon is cutting out the tissue and pulling that tummy down without consideration of saving or using more appropriately any of the blood vessels that lie within that tissue. That tissue that's taken for a tummy tuck, it becomes your breast.
Okay.
And so here's the thing. You do get a flatter tummy from it, but this roadmap of blood vessels that I was talking about before, that I mentioned before, it's the roadmap is there for everybody, but it's different for everybody.
Okay.
And so sometimes a woman might have a higher scar for a deep flap than she would a regular tummy tuck, because they have to optimize finding the best blood source. And, I'm not a microsurgeon, Melissa, and without getting into too many technicalities, you do get a flatter tummy, but it really is different. A tummy tuck is a cosmetic surgery. It's a cosmetic plastic surgery.
It's a totally different approach, it sounds like.
Totally different approach in some regards. A deep flap is reconstructive surgery. And so I guess the beauty of it is breast reconstruction is paid for by insurance if your mastectomy has covered your insurance. Tummy tuck is cosmetic surgery. It's an out-of-pocket expense for patients.
Sure.
But I guess the beauty of a DIEP flap is you get that tightened tummy, and you have new breasts that are made from the tummy that was taken. So
Well, thank you very much. I actually love that you. No, this is great, and I love that you didn't use too many technicalities because it's sometimes easier to digest and understand hearing it in layman's terms from another breast cancer advocate like yourself. You walk the walk, so thank you for explaining that. I think it makes a lot of sense. So in other words, with DIEP flap, you definitely get the benefit of a flatter stomach because they're taking tissue, but it's certainly not as extreme. And it's focused of a surgery on that area as a tummy tuck.
Yeah, and the other thing too that I might add real quickly with a regular tummy tuck, they take those muscles underneath there, and they really the rectus muscles, and they really sew them up and tie them down tightly. That can't always be done. They tighten them during a DIEP flap too, but it would compromise the abdominal area. And sometimes if that's done too much during a DIEP flap, that can potentially cause a bulging. And so it's there's similarities, but there's definite differences between a DIEP flap and a tummy tuck.
Well, thank you for defining that. I think that you've made it crystal clear. So thank you.
I don't know if I've done that. And, if patients are thinking
it makes a lot of sense.
Yeah, they should ask their surgeon about it because similarities but differences.
Absolutely. And certainly if that's something that a patient wants to look at, that's something that they should, like to your point, should speak to their surgeon about. So thank you for shedding light on that. My next question is, do patients require post-mastectomy breast rehabilitation with DIEP flap? Do most of them need it, or is it just very case by case?
By rehabilitation, do you mean physical therapy?
Yes, physical therapy.
Oh. I would say not everyone does, but I encourage them to ask about it. I think that it should be part of the conversation, either at your follow-up consult or, even before you have your surgery, asking your surgeon if you will need follow-up physical therapy. Because, with any surgery, areas of your body are compromised. And certainly with breast surgery, as you know, Melissa, you have a lot of arm work. They check lymph nodes. And so I think it's important to at least ask about physical therapy. And for DIEP flap, what's even more important, I think, is to ask about scar adhesions. Scar adhesions, especially in the abdominal area, can be painful for some patients. Because if they start to develop and they're not worked on, they're not, they don't have physical therapy, they can become tight. Scars have a life of their own. And so as they kind of mature over time, if they're not rehabilitated, as you said, they can be problematic for patients. So it really helped me after I had DIEP flap.
Wonderful. Thank you for sharing that and your own personal experience. I mean, I have breast implants, but I did have post-mastectomy rehabilitation because I had issue with range of motion. So it almost sounds to me, and I could be wrong, whether you have implant, no matter what your route of reconstruction is, it may not determine that you definitely need rehab or not. It's very case by case, so I'm sure there's plenty of women that have implant surgery that don't need rehab. There's plenty of women that have DIEP flap that don't need rehab. It just depends on what the issues are.
Yeah, but I think they need to be aware of it because, like you said, Melissa, a lot of women are affected by range of motion after this surgery. I think what happens too is we become very protective, and you see me going like this, but that kind of is a posturing. I don't know if you ever felt like that after you had your.
Oh my God! I remember being in New York, like being in an elevator, and I was like I just wanted to put a wall around me. I couldn't. It was so stressful.
Yeah, and I think that stress and that kind of wanting to, protect ourselves can also compromise a lot of shoulder and just the range.
Okay, that makes sense, right? Because you're almost like it's like it's just like a reaction, and you may not even realize that you're walking around that way, but you are, and it could strain on those muscles, and then all of a sudden you need rehab.
Yes, and with deep flap too, because they tighten the tummy down. I would add that women they want you to be in a little bit of a beach chair position the first week, but then they want you to start gradually, getting your posturing back, and so a lot of times physical therapy can help with that tightening of the abdominal muscle. So yeah.
As you're saying this, I'm like, I'm sitting up straight.
I know, it makes you think about it, doesn't
it? Thank you for the reminder. Sit up straight. No, thank you. That makes a lot of sense. And I guess the takeaway here is no matter where you are in your decision-making process, your breast cancer process, your rehab, reconstruction process, keep in mind to ask your doctor about what your options are for rehabilitation, what you might need, and just even having the name of a therapist just in case, so that you're not scrambling after surgery.
Yes, I think that's a good idea. I used the same surgeon that I had after my mastectomy, so it was an easy transition for me. But a lot of times too, I might add that if you ask your surgeon, your plastic surgeon, if you've had implant or autologous reconstruction, a lot of times they'll have a reference for you. They'll have physical therapists that they've worked with. I might also add, Melissa, to this that with breast cancer patients, I always ask them, I've written a blog on it, I encourage them to ask for a certified lymphedema therapist. So
could not agree more.
Yeah, because they're so familiar with the lymphatic system and everything that's been compromised, and I really believe that that's an important.
In fact, thanks for the reminder. I'm going to. I know that I've been speaking with the folks over at AiRing, lining up the guest list for the next few months, and I think a lymphedema expert would be fantastic. That's a whole other education.
Yes, very good.
So important. Here's another one. If you're over a certain age, are you no longer eligible for DIEP flap?
I love that question. The short answer is no. I have talked to surgeons who have done DIEP flaps on women that are 89 years old.
Wow.
Isn't that amazing?
Really how long is the surgery generally? It's several hours, isn't it?
Well, that's another thing that I think sometimes is a misconception. It really the time that you are actually in surgery, I think a lot of women think about when they enter the hospital, prep, waking up. That's not part of surgery. A lot of it depends on how many surgeons there are in the OR. I wanted a team of doctors, so I had two. It depends on if they're doing a unilateral breast reconstruction or single. And it also depends on what type you're having. Implant, of course, goes quicker. Autologous takes longer. Roughly for autologous tissue, it's around 6 to 8 hours. But going back to your question about age, it really depends on your overall health status. You can be a completely healthy 89-year-old woman who has no other medical comorbidities and be a candidate for DIEP flap. It also depends on your body habitus too, Melissa. Skin laxity and if you've had radiation before, those all come into play when a surgeon makes a decision about the fact that you can or cannot have or are a candidate for DIEP flap. But really, that's the answer to age. And
very interesting. So the baseline and the determining factor if you're a good candidate for DIEP flap is not age-based, it's health-based.
That is absolutely correct. That is absolutely correct.
No. So we're just demystifying the whole DIEP flap situation. This is great. Yeah, I'm learning a lot because I never really dove into it as deeply. This is really, really good. And I hope that so many women that are watching this are taking it all in, because these are all questions that we might even forget to ask the doctor.
There's so many to ask. I think the important thing too is that you have to be very transparent about any health issues that you've had. For instance, some women say, well, I've had hernia repair before and mesh was used. That doesn't preclude you from having DIEP flap. If they have mesh in the abdominal area, it doesn't preclude you from having DIEP flap. What it may mean is that the surgeon may have to do a CT angiogram to map out your blood vessels prior to surgery to make sure they can find them if there was mesh used. Women that have had C-sections, oh gosh, I've had a C-section, I don't think I can have a DIEP flap. That doesn't mean you can't have DIEP flap. I know women who have had 2 or 3 C-sections and they've had successful DIEP flap. I know women who have had DIEP flap who have gone on to have children afterwards.
Wow. Oh, see, I didn't even have that in my lineup of questions. That's a great question.
Yes.
Wow. It really is incredible what they can do with surgery. Wow. Thank you for sharing that. That's really good for all the new moms or moms to be, or if you're thinking about being a mom.
Well, I think about women who are BRCA positive or have another genetic mutation that puts them at very high risk of getting breast cancer, and they're young women. And those are the ones that are asking me, I want to have another child, or I haven't had a child yet. I just found out I have a genetic mutation. I want to have a prophylactic mastectomy. I'd like to have a DIEP flap, but I don't know if I can have children again. And so I've interviewed a couple of women that have had very successful pregnancies after DIEP. But again, you need to tell your surgeon. You need to tell your microsurgeon if you're having DIEP flap, I really would like to have a child after this, and coordinate that care with them so that they know.
Perfect. Thank you for that point. That's excellent to know. And while we're on this topic, what are some of the key questions that you recommend one would ask their doctor before they make a decision and confirm a surgery date? Or maybe you can mention a couple, and is this available on your website?
Yeah, well, so some of the resources that the foundation provides is my blog, and it's called DiepCJourney.com. And there is
DiepCjourney.com. Everyone check it out.
Yeah, DiepCJourney.com.
I love the name of your organization, by the way.
Oh, thank you. But I do have resources on there that list the questions that you should ask your doctor. And of course, they're going to be different if you choose implant versus autologous, or using your own tissue. But really, you should be asking your surgeon if they're board certified. First of all, you should be asking them how long they've been doing the procedure, what their success rate is. For DIEP flap, when you talk about success rate, Melissa, basically what you're talking about is how many flap failures they've had. And flap failures can be very traumatic for a patient who is going in. They have this entire surgery. Something happens with the blood vessels after the DIEP is performed. And usually it's going to happen within the first few hours to 24 hours after the DIEP flap. Something happens. There might be a kink. There might be a blood clot. In the best of hands, it can happen. But I want to point out it happens very seldom. There's a very, very low rate, and I've done the research on that there's a very low incidence of flap failure.
Okay.
So I don't want people to be fearful of that, but I have to tell you that women that's one of their biggest fears, is that their flap is going to fail and they will lose it. Happens very few times, but you need to ask the surgeon that you're going to what their flap failure rate is. It's important. I wanted a 99% or higher flap success rate. I wanted to know there were 2 surgeons in the room. That the team that a microsurgeon works with is very important. They work with PAs, they work with other nurses, they work with other microsurgeons, and I wanted 2 surgeons in the room because it minimizes the time not only for the surgeon but also for the patient.
So sorry, when you say two surgeons, you mean a microsurgeon and a plastic surgeon?
I mean, if you're doing a DIEP flap, 2 microsurgeons.
Two microsurgeons, right? Because it's so the complexity of it. That's the reason.
Yes, and so they work together as a team. One, it really depends. So let's say you're going in for a mastectomy. It might be 3 surgeons in the room. You might have a microsurgeon who might start harvesting the tummy flap.
Okay.
Then you have a breast surgeon who might, they'll be doing the mastectomy. Once the mastectomy is done, which, generally a mastectomy can be done in a couple of hours, the breast surgeon leaves, the other microsurgeon comes in and starts working on the breast area to harvest the blood vessels to receive the flap. So, I mean, it's just like a well-orchestrated.
It's a real process with several steps.
It is. So if when I say 2 surgeons in the room, what I'm talking about is 2 microsurgeons, but it can also include a breast surgeon at some point. For me, it didn't, because I had my mastectomy, first, and then I had the delayed DIEP flap.
Okay.
But in an immediate DIEP flap, the mastectomy can happen and the DIEP flap can happen all in one day. And so then you might have an incident of having 3 surgeons in the room, breast surgeon and 2 microsurgeons.
Okay.
So.
Got it. Thank you for explaining that. Very, very good to know. And what would you say is the best way to find a surgeon who truly has expertise in DIEP flap breast reconstruction? Is there on your website, or how would you direct someone that is just starting to scratch the surface?
So yeah, that's a really great question, because that is just an important piece of the process for patients. And the American Society of Plastic Surgeons has on their website, asps.org, I believe it is the name of it, but it's the American Society of Plastic Surgeons. If you look that up, they have a surgeon finder, so you can go geographically. What I've done, Melissa, because of my advocacy work, but also talking to other patients, I have a resource page, and it's not, those surgeons are not necessarily endorsed by the foundation, but what I've done in going to conferences, listening to patients, I've started loading that page with microsurgeons across the United States that perform DIEP flap. So here's my caution. When you can always go to those 2 resources. My caution when patients talk to other patients about their plastic surgeon, they may be an amazing plastic surgeon, but perhaps they didn't get along personality-wise.
Right.
So then, you get a little bit of a skewed opinion. So I think the best thing to do, really, the process that I did, I researched on my own. I looked at curriculum vitae. I looked at their success rate. Then I started asking other women, did you go to this surgeon? What was your experience? What did you think about it? Then I made my decision on who I was going to go to. And honestly, sometimes women have to go to 2, 3, 4 surgeons, because there's a process called shared decision making that I'm very endeared to, and I like to talk about. Patients generally know, and I'm sure you did, Melissa, when you talk to your plastic surgeon, you walk into the office and you start talking about all the options, the risks, the benefits, the healing process. When you're in the office, you have that sense of trust.
Absolutely.
Right? And I've heard women say,
it's a gut. I mean, look, it's like you want to do your research, and like you said, you want to ask people, but I think it's also it's a feeling, it's a relationship, and you want to feel comfortable.
It absolutely is a relationship that you develop, and it starts at the consult. So, I mean, I've heard women say, I went into one surgeon and I walked out of there and I felt shut down. I didn't feel listened to. And I tell them it's time to move on. It's okay. You can get a second opinion, a third opinion. It's okay.
Right. So. Because it's such a huge decision, and it is, it's a life-changing chapter. You definitely want someone that's compassionate. You don't want to feel rushed. That's always the worst. I know for me, when you're, especially in a consult, if they're kind of like, all right, I have a patient number, whatever, at the door, are we good? So you never want to feel rushed.
Yeah, and I think it's an important question to ask before you even go into your consult. Call the office and say, how much time is allowed for my consult? How much time am I actually going to get? Because patients have to be realistic too. These doctors are
That's
incredibly busy.
true. That's true.
And
Right. You can't, you need to be mindful of their time. And that's why, I think it's so great that your organization exists, because I think that you probably offer a lot of resources that can sort of cut down on a lot of the basic questions that one might ask, because I feel that yours is really, pretty robust.
Mhm.
So definitely, I would say anyone that is considering DiepFlap to check out your website before you speak to your doctor, because it sounds like there's a lot of good information there. Um, would you say are some of the biggest challenges that women and men face when they are affected by breast cancer? Either a diagnosis or finding they have a gene mutation, putting them at high risk of getting breast cancer. By the way, I just want to mention, I love that you include men in this dialogue. I think it's really important for us to focus on the fact that men do get breast cancer, and men also do need breast reconstruction options. So, what would you say are some of the biggest challenges when it comes to a breast cancer diagnosis?
Well, I think first of all, there is the emotions that you deal with. And that ranges for people. We all handle stress in daily life differently, some more than others, or some better than others. So I think you have to give yourself time, because breast cancer, generally speaking, is what I call, and what many call, an emotional emergency rather than a medical emergency. Now, there are some breast cancers definitely that have to be treated sooner than later. But in most cases, Melissa, you can hit the pause button. So after you are diagnosed and you have this overwhelming emotional, uh, you know, trauma that's come into your life, I like to say mental clearance sale. Everything must go.
Wow,
Just
I like that.
yeah, that's our little family mantra. But you can take some time to do your research. I know that some women and men have told me, after I get past the emotion, then I want the facts.
Hmm.
Because I think what the facts do is help women and men to feel like now they're in control. Okay, I'm finding out what science says. I'm finding out what the latest surgical options are. Like you said, even for men, they can have reconstruction too, whether it's a small implant or fat grafting. They can do nipple reconstruction. Um, so take the time to do your research and find. I really encourage folks. There's some great websites out there. There's some great Facebook pages, but find ones that are evidence-based. We deal with enough drama in our lives, unintended drama, when we have breast cancer, that I don't think we need to stir up more drama, in unintended conversations. Find support that is evidence-based, that's science-based, and is positive. And take your time, ask all the questions you need to ask, take notes. There's some great decision aids out there, whether it's your paper and pen or apps that you use, that will help you sort out all this information so that you can go in prepared to your consult.
Great
And
advice.
so
Perfect. And
I,
I think you're making a very good point also about, I think there are some really great community, like Facebook pages and groups. And I think those are good to a point, but when it comes to making those critical decisions for yourself, you do want to consult with a doctor, or, like you said, something that's evidence-based.
Yes, to me, it's kind of a combination of both. Get your community support,
Yep.
but then write down your notes, write down what your personal values are, and take it to your consult and ask the questions.
Perfect.
So,
Yep, I couldn't agree more. And so, why did you find it to be important? Why was it important for you to establish a community and for you to establish your foundation for breast reconstruction?
you know, I got to tell you, Melissa, I'm a lucky gal. I just think I'm a lucky person. My parents taught me to put one foot in front of the other in life, no matter what you are handed. And I I'm surrounded by some amazing people, not only my family, but my friends. And I think that I was given a gift to want to pay it back. It is a gift that was given to me. And for me to not do anything with that, I,
Oh my gosh, Terry, you're amazing. Don't make me
I,
cry. Oh,
well,
you're
you know
amazing.
what, Melissa? It's true. I I was led to this job that I have now. I really believe that I was led to it. And as difficult as it was to start this foundation, I started it in a cathartic way by writing my blog. But then when I was encouraged to open the foundation, every single day, every single day, I meet somebody that just is tapping me on the shoulder and reminding me I've got to keep doing this work, because just when I think all the questions have been answered, just when I think, okay, well, I think, we've,
Wow,
this,
you're oh my God, you're giving the goose. I mean, you really are an incredible resource, and you've walked the walk, and you've done it, and you continue to, stay on top of what the latest innovations are. And I think you're such a light for really for men and women. I keep saying women, but for men and women, to have this option and to know that all these resources are there. And I think it's really amazing. So um, I also want to mention that I think it's wonderful that you and AIRS have also partnered, and you know like and I'm sure you agree. I love how AIRS raises money for men and women that can't afford breast reconstruction. So how do you work with AIRS? Do you share them as a resource on your resource page?
we do. We both share the information that each of us have about education, because under my IRS designation, my gift is education.
Okay.
And so what we can do, though, is that we can share our resources with people like AIRS, because we have a like-minded mission statement. And so what I really like about partnering with AIRS to help other women, both with their resources, but with their financial assistance with breast reconstruction, I like to think of it as one big bucket of service and resources and
Beautiful.
help.
I love that.
And and
Right.
to be
I mean, AIRS is obviously also, providing education, but yours is so specific. And then to have also this bridge of a financial support is really beautiful.
Yeah, it is. It is. And when I find out, about women that are using both resources, man, that just jazzes me, because then I realize what a
It jazzes me
community.
too, Terry. I love that.
I know. This
It
bump.
really
This bump. Yeah.
is.
It's and I have to give a shout out to, really, I would be remiss if I didn't give a shout out to the health professionals that are so willing to help me with this education, whether it's microsurgeons, radiologists, and the patients. It's a community of service and helping each other, I think, through this process. Because, Melissa, you get the diagnosis and then you have tons of decisions to make.
Yeah, and meanwhile your head is spinning, and you're asking your family, what should I do? It's like you said. I think a really good takeaway is it's okay to hit the pause button. It's, yes, listen, I had triple negative breast cancer. I couldn't just sit on it and think about it for a while. But, I also, not to go off on a different tangent, but I had a vacation booked right before I was diagnosed. And my oncologist was like, go to Punta Cana, enjoy yourself. And then when you come back, you're gonna have some work to do. It's not like, you, God forbid something happens, you're in a car accident, you have to run to the emergency room. So to your point, you can hit pause and do your research and do your homework within reason. Ask your doctor how much time you have to make this decision and really think it through and do the research.
Yeah, it's important because, like I said, sometimes I think, I don't know if you ever felt this way, but sometimes you feel like you're free falling after a diagnosis and you don't know what to do. And so giving yourself that control back and knowing what you can do, knowing what the possibilities are, I think it's empowering. And that's something that you can do with time and research. So
absolutely. And I think, I could talk to you for hours. This is amazing. You've really taught us so much about what deep flap surgery is, about your own personal journey, about doing your homework, about asking the right questions. So I encourage everyone, and we're going to have this in the comments, the link to your website so that everyone could just go and jump on. And even if you're a caregiver or a friend or a family member, you can share it with someone that is maybe in the middle of making decisions. But I just can't wait to see what you're going to do next. And I can't thank you enough for, creating this resource, but also a community and this incredible partnership that you have with AIRS, which is really a match made in heaven.
I think so too. And I'm so glad that we were able to connect and to share this information today. I really appreciate it. And again, I'm just kind of jazzed. I got to meet Cancer Fashionista.
Oh, well, like I said, I've been admiring you, so you've made my day equally as bright, really. And this is just the beginning. I look forward to, seeing what you're doing out there in social media land, and I'm sure we'll be speaking again.
Yeah.
Thank you so much for joining us. And again, I want to thank AIRS for creating this platform and the series, which I love. We call it Airing It Out series, which we're going to be continuing for the next few months and beyond. And AIRS Foundation is just a wonderful resource that focuses on breast reconstruction from both a knowledge and education perspective, as well as a financial resource for those men and women who cannot afford breast reconstruction. AIRS will help you. All you have to do is go to the website and apply, and just keep your eyes peeled for more Facebook Live events, which we'll be posting here. And thank you again, Terry.
All right. Thank you to AIRS for having me, and great to meet you, Melissa. Stay safe.
You too. Wonderful to meet you, Terry.
You too.